All right, well, this morning, we're taking a look at some of the top medical miracles of 2025. First up, we're highlighting a new burn cream that gets rid of dead tissue after abrasion and blast injuries. Our next guest wrote about this in his New York Times #1 bestseller, The Miracles Among Us, How God's Grace Plays a Role in Healing. Fox News senior medical analyst Dr. Mark Siegel joins us now. Doctor, it's always great to see you, my friend. So, Doctor.
Hi, Lisa. Good morning.
Good morning. So walk us through, how did this innovative burn cream, how does it work? And what did it do? What did you see it do?
Well, you know, it came from pineapples, and they made it out of pineapples, and Israel is one of the first places in the world to use it. So they used it on October 7th, and it was a miraculous recovery of my patient, Alei Hagega Golan, and the publisher of my book said, that's the main miracle in the chapter. There was about 15, and we were always searching for the main miracle because that replaced the need for surgical debridement using a scalpel. And now I'm calling it a major miracle, medical, technological miracle of 2025 because it's now used all over the world. It's approved for use in the United States, and a study just a couple of weeks ago shows that it's useful for traumatic tattoos, meaning if you get injured in battle, in combat, and you end up with a disrupted skin or a projectile or something that has to be removed, you don't end up with scarring, you don't end up with pigmentation problems, you end up with beautiful skin after using this cream. So this cream is a miracle cream, and we predicted it in the book, and now it's coming to bear. It's 2025 technological medical miracle.
Well, and would make a difference for so many Americans, as you just pointed out, and so many people around the world as well. So, Dr. Siegel, you also had a patient who almost died from heart failure and liver failure when a just-approved valve brought him back. How did it bring him back? Talk about this valve treatment.
You know, this is also, this will be in the next book. This is the way the miracles work, because Sam was a patient who had severe heart failure, severe liver failure, was lapsing in and out of comas, was on death's door, and I got him into a place where Dr. Kadali at Columbia was just starting to use these valves. And the valve, the transcatheter tricuspid valve, is something that was just approved by the FDA this year. You sneak it in through an artery in the groin. You thread it up through the heart, the way we've been doing for years with the aortic valve. But this is the right side of the heart, the tricuspid valve. It just approved. And he said, you know, I don't know if we have one that will really fit Sam. It's so new. But he did it, Lisa, and literally, Sam responded where his heart failure went away. He came out of the coma. His liver returned to normal dramatically. He walked out of the hospital, and he's now having a normal life, all because of this incredible medical miracle, this valve.
So now, not only did it save him, but now he's being able to live a pretty normal life as well. That is a miracle. You know, Dr. Siegel, one family.
Look at him walking. Look at him walking.
Oh, there he is. Yeah, we see him.
He's
yeah,
amazing.
He looks great. Oh, yeah, look at him. He looks great. And no, Dr. Siegel, one family also got a medical miracle as their young baby with a rare disorder was cured and able to take first steps before Christmas after gene splicing. Tell us about this.
Patient's name is KJ Muldoon. This is the future. This is cell genetics. This is using genetic editors to edit an abnormal gene, your DNA, your genes, in this baby's body to reverse something that was a death sentence at birth that would have led continually to a buildup of uremia, waste from the kidney that turns into ammonia that would have definitely finished off this poor baby. But they use genetic splicing, personalized medicine, again, to fix the genetic abnormality and give this baby a normal life. And right before Christmas, KJ was walking. Look at that beautiful baby. That's the future. We have to figure out how to afford this with the healthcare system, but we're all going to be facing a future of personalized gene therapy, ways of affecting diseases before they ever happen and fixing them when they do.
And I was listening to you, but it was also hard because that adorable baby was on the screen and I was looking at his cute little cheeks. So thank God for him, and thank God he's taking his first steps. And everyone go out and get Dr. Mark Siegel's book, The Miracles Among Us. It's available now. Thank you, Dr. Mark Siegel. We appreciate you. We've also got a big hour of Fox and Friends ahead.
Hey, everyone. I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.